Good afternoon, everyone. I'm here to give you the regular update in relation to the novel human coronavirus infection. Currently, the number of confirmed cases in New South Wales remain at 4, with no new cases identified since Tuesday. We discharged 2 patients on the 29th of January, and the close contacts of the cases are being monitored by the Public Health Unit for those 14 days since their last exposure. And to date, we haven't identified any cases of coronavirus infection in the contacts. There's currently 16 new cases under investigation, 10 men, 6 women, age range 3 to 74 years, and all of these patients are in isolation whilst awaiting test results. So since testing began, we have tested 67 patients have tested negative and so have been ruled out, including the 17 cases yesterday. So as you've seen, the case numbers coming forward to testing have remained high, and that's very pleasing that our messages around coming forward if you develop respiratory symptoms after you've travelled to China, in particular focusing on the Hubei province, but also if you've been a close contact of a confirmed case. Thank you. I'm happy to take questions.
There's been some speculation about the animal origin of the virus in recent days. Have New South Wales authorities had any briefings on that?
We're actually having a webinar this afternoon with our expert virologist. The thinking as of a couple of days ago was that the origin may well have been bats, and then it's transitioned through another mammalian species and then acquired the ability to infect humans. But obviously this is subject to a lot of international speculation, and I'll be keen to be updated on any of that this evening.
The CSIRO has been growing, or managed to grow a copy of a coronavirus at one of its labs in Melbourne. Will that have any benefit for New South Wales? Is New South Wales involved at all moving forward in the sort of tests that might be useful?
I think you're referring to the Victorian Infectious Disease Laboratory in Victoria. They are the reference laboratory, and as we've been undertaking testing, we've actually been sending in the early days a number of the tests down so that we could validate with across the 2 laboratories. It's pleasing to note that they've cultured the virus, and our laboratories will be undertaking further testing on samples we have as well. It adds to scientific knowledge. I suspect there's other investigations also being undertaken. So all of this information is rapidly shared and is used internationally in informing our response.
Authorities have been trying to track down, I think it was 170 odd passengers that were on a flight from Melbourne to the Gold Coast, along with 2 now confirmed cases of coronavirus. Do you have any information as to whether any New South Wales residents were on that flight?
Look, I have to follow that up and provide. Normally we work very collaboratively across states where information around our residents is shared, so I will follow up after this conference. And
do you have any information on any New South Wales residents among those being evacuated out of Wuhan?
At this stage, I think you're referring to the Commonwealth initiative to repatriate people from Wuhan. In that case, I haven't got any update. We haven't been provided with information about how many New South Wales residents would have stepped up or come forward for that evacuation.
The World Health Organisation changed their designation today. Does that affect anything in New South Wales?
New South Wales and all of the states and territories in the Commonwealth have been following the plans that we have in place. It doesn't make a significant difference to our approach, but clearly highlights the importance and the need for us to be vigilant, take a precautionary approach as we better understand how this virus is going to progress.